Hello, everyone, and welcome. Thank you for joining us in today's panel webinar, The Impact of COVID-19 on Inequalities and Work. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness Institute, and I'll be moderating today's webinar. We would like to thank our academic team and our 9 founding partner organizations in the Harnessing Talent project. Harnessing Talent, Alliance for Recruiting and Retaining Canadians with Disabilities and Mental Health Challenges, is a 3-year project funded by Employment and Social Development Canada. This webinar is made possible through the support of ESDC, as well as donations and memberships to WWI. We thank our advisory committee and speakers who contribute to this webinar series. To members, WWI, VRA Canada, or CPHR Alberta members, a reminder that you receive free certificates of attendance. We're honored to welcome our presenters, Dr. Yana Rodgers and Melissa Egan. Yana Rodgers is a professor in the Department of Labor Studies and Employment Relations and in the Department of Women's and Gender Studies at Rutgers University. She also serves as faculty director at the Center for Women and Work at Rutgers. Yana specializes in using quantitative methods and large data sets to conduct research on women's health, labor market status, and well-being. She has worked regularly as a consultant for the World Bank, the United Nations, and the Asian Development Bank, and she was president of the International Association for Feminist Economics. She currently serves as an associate editor with the journals World Development and Feminist Economics. Yana earned her PhD in economics from Harvard University and her BA in economics from Cornell University. Melissa Egan is the coordinator of Episodic disability initiatives at Realize and has worked in the field of health and HIV for over 15 years as an educator and facilitator. Melissa's experience includes frontline work at YouthCo, a peer-led agency worked to reduce the impact of stigma related to HIV and Hep C. She spent 8 years as a regional educator for the Prairies with Katie, an organization that works to strengthen Canada's response to HIV and hepatitis C by bridging research and practice. Using her training in curriculum development and adult education, she also helped to create online learning courses about HIV and hepatitis C basics and preventing the sexual transmission of HIV, along with the webinars on pregnancy and HIV and the realities of young people living with HIV in Canada. She has worked extensively with marginalized LGBTQ and Indigenous people development and delivering workshops across Canada. Yana and Melissa, thank you so much for disseminating your knowledge and expertise around the impact of COVID-19 on inequalities and work. I will hand it over to you without further ado.
Thank you very much, Yusra, for your gracious introduction, and also thanks to you and to Jennifer for inviting me to speak today. And Melissa, I look forward to hearing your presentation. And it's a pleasure to learn more about the work of the Work Wellness Institute. So this talk today will be based on a couple of articles that I've been working on. One is the introduction of a special issue of our journal of Feminist Economics that is coming out online any day now. So what you'll be hearing on are some of the findings in our special issue. And I've also written a couple of other pieces on COVID-19 and kind of brought all these findings together in today's presentation. So given the interest in inequality and women and work, I'll be focusing largely on gender discrepancies in the impact of COVID-19. And we've seen a number of gender dimensions of the pandemic. The data do show that men have a disadvantage when it comes to morbidity as well as mortality from the virus, but those disadvantages for men end there, and we see other disadvantages more for women in other aspects of the pandemic, especially women's disproportionate representation in frontline jobs. And many of these women are minority women or women of color. especially in nursing and other low-wage essential jobs. For many countries, job losses have also been disproportionately female, largely because women are working more in those industries hardest hit by the pandemic and the work closures. And more recently, we've seen more exits out of the labor force completely for women compared to men. And the evidence is beginning to show that women are leaving because of care reasons, closures of schools, closures of daycares, and the need to take care of children. The data is also showing that work at home has increased, unpaid work, and this discrepancy is increased more now during the pandemic as well. And there's also been other gender dimensions in terms of more violence against women in the home, as well as policies that have made reproductive health care more inaccessible. So this crisis is really pointing a spotlight on the need for care and the need for a care-led recovery. So policies that focus on paid healthcare workers, keeping them safe, and policies that focus on all of the care that's provided in the home, that's unpaid care, as well as even paid care provided by paid care workers. And decades of feminist research show that care work is often undervalued, still is, and until recently it's been quite invisible, less visible during the pandemic. But women really have a disproportionate role in performing this care, both paid care workers as well as unpaid care. So these studies that have looked at women and care really help us to come up with some valuable lessons that should be included when formulating policies to recover from the pandemic. It's not enough just to have economic recovery policies. We also need policies around care. So let me show you some of the data then to support some of the statements I've just made in the last few minutes. This chart here shows the proportion of COVID-19 reported cases that are male and female, and the light blue is the cases that are male, the proportion male, and the darker blue is the proportion that's female. And you can see in the majority of countries, more women than men contract COVID-19, the virus. And on average, of all the countries that report sex disaggregated data, taking a weighted average, men account for 52% of all reported cases and women about 49%. And men's share of COVID-19 deaths is even higher, 58%, compared to 42% for women. A number of countries that do report data also show higher rates of morbidity and mortality for racial ethnic minority groups, as well as people who are low wage and low income. And the medical literature is showing there's a number of reasons why men are more at risk, especially for mortality. They include riskier health behaviors, especially smoking and drinking. They often have more comorbidities like heart disease and hypertension and diabetes. They're less likely to wash their hands and take other safe health practices. And there's even evidence showing that their immune systems are not as effective as those of women. But as I mentioned, the gender disadvantage turns, and for other indicators, we see women are bearing more of a burden of this pandemic. They are across countries disproportionately employed in the frontline industries, like grocery store workers, public transportation, logistics, cleaning services, healthcare, and childcare. On average, in the United States, where I was able to find some data, 64% of workers in these frontline jobs are women. And people of color are also disproportionately represented in these kind of jobs compared to their representation in the overall workforce. It's difficult to come by this data globally to compare countries. I was able to find some data on nursing, which is also predominantly female. It's another frontline job. And nurses in particular have been at greater risk of exposure to infection, as well as incredible stress on the job and more depression than other occupations. And this is some data from the World Health Organization showing that across regions of the world, nurses are disproportionately women, especially in North and South America, including Canada. 86% of nurses are women. We've also seen women bearing more job losses than men. So this is data coming from the International Labor Organization. They've been tracking employment losses in a COVID monitor. Comes out every couple of months. It's really useful data, and showing for these 18 countries, in 15 of the 18, women's employment losses between April of 2019 and April 2020 were bigger than those of men. And related to lost jobs is also lost income. This is also ILO data that includes transfers and post-government support, so support from the government. And again, these losses in most countries for which the ILO has data are larger for women than for men. Two big reasons for these employment losses. One is that women were more likely to work in sectors that had more business closures because of the lockdown policies, especially in entertainment, hotel, food service, and these others listed in the presentation. Overall, globally, ILO data indicates that 40% of women workers compared to almost 37% of men workers were working in industries that were the hardest hit by lockdowns early in 2020, early in the pandemic. Another reason besides their employment in these hard-hit industries is that women have been more likely than men to leave the labor force in order to provide care at home. And there's a decomposition procedure that the ILO did that looked at employment losses globally and the reasons for those employment losses. So as you can see in this bar chart, overall, a little more than 4% of jobs were lost in 2020 as a result of the pandemic, and 3.4% of the little more than 4 was due to labor force exits, and about 1% was due to people losing their jobs but still looking for new work, which would be official unemployment. These are the overall job loss was higher for women at 5%, and an even larger proportion was due to labor force exits. Again, this is globally. Men had smaller job losses, and a bigger chunk of that was accounted for by unemployment rather than a complete exit out of the labor force. There is also emerging evidence in our special issue and in other studies showing that both men and women are doing more unpaid care work at home, but women are doing relatively more. So there was some good data collected by UN Women and Women Count for 9 countries, well, depending on the indicator, roughly 9 countries in Asia and the Pacific. And I'll show you the next chart, but overall it showed that both men and women reported more unpaid care work as well as more unpaid domestic work. But the increase was greater for women than for men. And if you consider the intensity of this work, which UN Women defined as doing at least 3 activities, spending more time in at least 3 activities, almost 1/3 of women reported an increase compared to 20% of men in the intensity of unpaid work at home. So these are the countries, is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 countries for this particular indicator. This report had a whole bunch of indicators for Asia and the Pacific related to the pandemic. So for people looking for data, I do recommend this source, which I have at the end, the full citation. And you can see here what I just highlighted in the previous slide, that in most countries, relatively more women than men reported an increase in at least 1 activity of care work or domestic work. And the circles are the intensities, at least 3 activities an increase. And generally more women than men reported an increase in the intensity of unpaid work at home. We had been hearing about and ourselves experiencing more work at home, and I worked with several members at my university to conduct our own survey early in the pandemic in May of 2020. And we used Qualtrics to conduct a survey of about 920 people in the US, and we focused on people living together with an opposite sex partner, and used a survey instrument that had been developed out of UC Berkeley on unpaid work. And then we added some additional questions on job satisfaction, job productivity, and the overlap between paid and unpaid work. And to try to engage a little bit with participants here on the webinar, we have a poll. So I believe that Yusa is going to do the poll questions. And the first question, and I'd like to ask that you participate in this poll for 3 questions now. I have 3 more questions at the end, and then we'll see how you are compared, how you compare with other people.
And we have some results, Yana, I can read to you. So 50% of our audience said more productive, 13% less productive, 25% about the same, and 13% not applicable.
Okay, great, thank you. All right, the second question is, how satisfied are you with your paid job during the pandemic compared to before the pandemic? Are you more satisfied, less satisfied, about the same, or is the question not applicable?
To how satisfied are you with your paid job during the pandemic compared to before the pandemic? 45% responded more satisfied, 27% less satisfied, 27% about the same, and no response for not applicable.
Wow, that's interesting. How many more people are more satisfied? I think that's very interesting. The last question is, are you providing childcare and or elder care at least 5 hours per day during the pandemic? Yes or no?
So are you providing childcare and or elder care at least 5 hours per day during the pandemic? Our audience response, 30% said yes and 70% said no.
Interesting. Okay, well, now you get a sense of the kind of questions that we asked. And in terms of our own results from our survey, we did find, consistent with our expectations, that men and women were both increasing the amount of time they spent on childcare and housework but women were still performing more. In terms of telecommuting, of our respondents, 1/5 said that they had been working from home at least some days of the week before the pandemic, but now close to 60% were doing work from home during the pandemic. And here we did not have any statistically significant gender differences. We did find some surprising things, and Melissa, maybe you have some comments on this if this surprises you at all. But we were finding, even in absolute terms, that men were providing more care for elderly and disabled family members than women. And this was both before the pandemic as well as during the pandemic. And we found that when men stepped up their contribution at home, that contributed positively to women's job satisfaction and their productivity. But this relationship did not go in the reverse direction. And this is a statistically significant relationship. So here's a couple of charts showing our findings. The blue bars are before the pandemic, and the orange bars are during the pandemic. And you can see both men and women are doing more in terms of childcare as well as housework. These bars show the percentage of respondents who engaged in at least 5 hours per day of childcare or housework. And it looks like for women, it's a little bit more. If I recall what Yusra said, I think we were at about 30% for participants said that they were doing at least 5 hours of active childcare per day. So that's in the neighborhood of what we found in our poll as well. In terms of elder care and disabled care, at least 5 hours per day, we saw that, again, men were doing relatively more than women, but it had increased during the pandemic for both men and women. And our statistical work looked at the association between women's job productivity and their job satisfaction and the amount of work men were doing at home for care and labor. And it was a regression analysis, which means that we controlled for a number of other characteristics. And we found that women reported a greater odds of being more productive in their paid work and being more satisfied with their paid work as men took on a greater share of their unpaid work. And again, this relationship did not hold in the opposite direction. Men respondents did not report the same kind of increase in productivity or job satisfaction. And this is a chart showing our predicted probabilities of being productive in one's paid job for women, and how that increases the more that men contribute to household labor. The emerging evidence is also pointing to other gender dimensions of the disease I mentioned in the introduction. Across countries, there are reports of increasing intimate partner violence and other kinds of domestic violence. And one of the articles in our special issue of Feminist Economics shows an increase of about 6% as a result of shelter-in-place orders in the US. We're also seeing in a number of countries more difficulties for women in accessing reproductive health care because of travel restrictions and lockdowns. And in the US, even legalities. There were 12 states last year in April that declared abortion as being non-essential early during the pandemic, which effectively amounted to abortion bans because it's hard to delay an abortion because after a while, both legally and physically, it's no longer an option. In the Philippines, more difficulty in accessing reproductive health services led to an additional 751,000 unintended pregnancies in 2020. We are also seeing worse effects by disability status, and Melissa will talk all about that. But I did do some research also, a recent paper looking at job losses, and they are more severe for people with disabilities, and especially women with disabilities and minority people with disabilities. And the other work with a gender dimension as to looking at the impact of COVID is looking at domestic workers who have seen additional risks in terms of job losses and abuses, as well as even being in legal limbo, losing their jobs in their host countries and because of travel restrictions, not being able to return to their home countries. So as I mentioned in the introduction, what's crucial is that we have a care-led recovery plan. And this kind of plan recognizes the different gender gaps that I've mentioned during this presentation. Gender differences in paid work and who holds which occupations, and gender gaps in unpaid work. And any care-led plan that recognizes these gaps will be integral, or any policies have to be an integral part of an economic recovery plan that promotes human well-being for all. And one of the key components of such a care-led plan is care for children and elderly and the disabled. So I think the provision of universally accessible free childcare and long-term elder care is a centerpiece of a care-led recovery plan. And we need to also invest more in quality childcare and elder care services, and where needed, like the US, a national paid parental leave policy, paid family leave, and paid sick leave benefits. Some countries still talk about austerity and closing budget gaps. This is not the time for that. It's the time to support workers. So boosting unemployment insurance, increasing the minimum wage, and investing in employment and training programs are all vital for a care-led recovery plan, especially training programs in healthcare. Finally, subsidies to small businesses will also help to bring back jobs, well-needed jobs. It's not only the government's responsibility, employers are also responsible for offering family-friendly workplace policies as well as accommodations for people with disabilities. And these need to be offered and destigmatized so that people are not penalized for taking advantage of such accommodations and policies, especially telework, job sharing, flex time, leave policies, and things like extended clocks for promotion or for tenure. And employers need to recognize the benefits of having a more diverse workforce and the importance of inclusion policies. And this is inclusion not only by gender, but also race, ethnicity, gender identity, sexuality, and disability. So I'd like to close with 3 more poll questions and then turn the floor over to Melissa. The first question is, have you seriously considered leaving the workforce, or have you left the workforce since the pandemic started?
Okay, and to the question, have you seriously considered leaving the workforce, or have you left the workforce since the pandemic started? 14% have responded yes, and 86% have responded no.
Okay, that's probably not a surprise given the composition of the participants. Have you been teleworking during most of the pandemic so far? Yes or no? Or some or not applicable?
Okay, and for teleworking during most of the pandemic so far, 67% have responded yes, 22% no, 11% some, and
Okay.
no responses for not applicable.
Thank you. And finally, has your employer changed your work expectations in a substantive way during the pandemic? Examples of that would be delayed tenure clock, greater flexibility, or a reduced workload.
Okay, and to the last question, has your employer changed your work expectations in a substantive way during the pandemic? 29% said yes, 57% no, and 14% said not applicable.
Interesting. So employers, it sounds like, are not doing very much to help workers, at least in this particular sample of participants. It's kind of sad. Hopefully things will get better in that regard. That's all I have. I'm going to end my screen share and turn the floor over to Melissa.
Perfect. And Melissa, you are on mute for the moment.
Just realized that. Thank you.
No problem.
All right. Hi, everyone. Thanks so much for being here. I know that we're all kind of zoomed out, but I really appreciate you being here to participate in this session today. Thank you so much to Yana. That was incredible information. I learned a whole bunch, so I'm really glad that I got to participate today. And as always, thank you to Yusra and Jennifer for your support, and the Work Wellness Institute for the invitation. All right, today we're going to talk about the impact of COVID-19 and specifically around inclusion and accessibility for people living with disabilities. I wanted to start off with an introduction to my organization, and I'm just going to figure out how to advance my slides. Here we go. All right, this is what we're going to do today. Talk a little bit about the organization, get into some of the impacts that people with disabilities are experiencing, go through some barriers, accommodations, and how we're making it all work. All right, so I work for a small nonprofit. We are located in Toronto, and what we try and do is to foster positive change for people who are living with episodic disabilities. We've been around since 1998. We came out of the world of HIV, and we've really tried to expand while also bridging the traditionally separate worlds of disability, HIV, and rehab. What we really want to do is improve the lives of people who are living with episodic disabilities in meaningful ways as best we can. We are the Secretariat for the National Episodic Disability Forum. We develop reports, policy briefs, white papers, and statements. We host policy dialogues, forums, and summits. We are partners on research grants. We do active policy work with government representatives, and we do lots of advocacy along with accredited training for HR professionals. So we're busy. Because most people don't always kind of understand what I'm talking about when I refer to episodic disabilities, let's just have a quick primer on what that means. So episodic disabilities are characterized by periods of good health, while they are sometimes interrupted by periods of illness or disability. Those periods can vary in severity, length, and predictability, and are different from one person to another. So often they're intermittent, invisible, and unpredictable. And that unpredictability tends to have a negative impact on community participation, on employment, on income security, social inclusion, access to care, all kinds of things. And as this presentation relates specifically to work, that's somewhere we see this happening quite a bit. Employers struggle with how to accommodate folks in the context of intermittent work capacity. So here are some of the episodic disabilities that we work closely with. They include mental health challenges like anxiety and depression, as well as PTSD and schizophrenia, physical conditions like diabetes and epilepsy, migraines, substance use. And one thing that we're beginning to include over the last couple of months has been long COVID, or what some are calling post-COVID-19 syndrome. The information that we have from a couple of surveys that we have just begun to analyze is that people are really experiencing intermittent fatigue and other symptoms related to COVID, despite the fact that they are in recovery from COVID. So that's something that we're really exploring right now. Episodic disabilities in Canada are increasing. We're seeing more and more Canadians who are experiencing them. The 2017 Canadian Survey on Disabilities show us that about 22% of Canadians are living with disabilities, and 61% of those people experience some kind of episodic disability. It's estimated that 6 million Canadians are living with arthritis, 77,000 Canadians are living with multiple sclerosis, and about 20% of Canadians will experience an episode of mental illness in their lifetime. So we're not talking about small numbers of people. These are folks you know. These are your family members. Maybe this is you. So as we go on, we kind of need to think about the impact on employment and really recognize that almost 53% of people who identify as living with an episodic disability are working part-time and associate that with their disability or health condition. Half of the people from this particular survey that we did reported that they'd changed jobs because of a health condition. They're more likely to be engaged in remote work or flexible work or be self-employed. And people with episodic disabilities experience significant concerns that are associated with rejoining the workforce because it may involve them losing access to government support, drug plans, or even subsidized housing. So let's bring this around to COVID again. Let's start talking about this particular context. For an overview, we can see that there are high rates of unemployment within the disability community, and those have already increased. The survey that was done by Statistics Canada in March reported that 36% of people with disabilities have experienced job loss, and 56% have experienced a decrease in household income of over $1,000 a month, which is a pretty significant shift in income. Work routines have changed for many of us, and employees may have disabilities that make a change in routine quite challenging to manage. To speak a little bit to what Yana mentioned earlier about racialized people, we know that folks with long-term conditions or disabilities are experiencing a decline in health since the pandemic, which is greater than that of non-racialized people. So there is additional concern. In Toronto, for example, we also see that parts of the city, parts of the greater Toronto area with more racialized people have higher rates of COVID-19 as well. Many people with disabilities who qualify for disability benefits don't actually qualify for the CERB benefit, even though the pandemic has caused an additional financial strain for this population as well. About a third of the people with disabilities who need regular help rely solely on family, friends, or organizations from outside of their household. And we can all recognize how the pandemic has affected us, and largely most of us are feeling it in the context of social isolation. So if that feeling of social isolation is then exacerbated by the fact that your whole support system and how you got, your help and how you lived a daily life that was really full and good, then all of that has gone away as well. So this pandemic is affecting us all, and it is significantly impacting people living with disabilities. So why, right? Why is that? Well, a whole bunch of reasons. There are barriers to lots of things like basic hygiene measures like hand washing, because many sinks, especially those in public places, are not physically accessible to folks who perhaps use wheelchairs or have mobility challenges, use crutches, that kind of thing. Or a person with a physical difficulty might be challenged with rubbing their hands together thoroughly and spending enough time. There's difficulty social distancing because of physical support needs, because of emotional support needs. And there is a need to obtain information from the environment around us. And when you think about that, you're kind of like, what does that mean, Melissa? What I'm talking about is when people who are, for example, blind or who are experiencing some kind of vision loss, they use the built environment to figure out where they are, to know which room they need to enter. And it's walls and doorways and signs outside of doors, these things are not disinfected with the same regularity as like doorknobs and elevator buttons, right? And so that kind of thought needs to be additionally inclusive, and it's not always happening. There's also barriers to finding accessible and inclusive public health information. Not everything is accessible. Not everything has subtitles or ASL or LSQ, and we need to really consider people with disabilities when we're thinking about health information access. There's also the possibility of pre-existing health conditions making someone's immune system even more vulnerable and making recovery time from an infection like COVID-19 extended and much longer. So how does this impact work? We've gone over a little bit of the general things. So how are we actually feeling this at work? Well, for some, it might be seen as a massive test of employers' ability and willingness to accommodate folks. And in some cases, that's what we're seeing. To address kind of how people with disabilities are being impacted by work in its current iteration, Zoom has some captioning, but it's not great. ASL and LSQ captioning and interpretation can be expensive, and it's also a way for people to communicate, and that needs to be considered. CART is communication access in real time, so it's in-person or dedicated interpretation where someone is listening to your Zoom meeting and actually typing things out rather than it being auto-captioned. It's much more accurate. Many of us are also experiencing longer days with more meetings. I don't know if many of you have had 5 Zoom meetings in a day, but on those days, I'm exhausted, and it's really, really tough to find the energy to stay animated and to listen. I think we're all experiencing a little bit of Zoom fatigue. It is of note that quite a few people who are living with disabilities don't have regular access to computers, don't have a reliable Wi-Fi connection, and that needs to be considered when we're asking people to work from home as well. Many of the environments where people with disabilities were accessing this kind of technology, libraries and community centers, are shut, and so we don't have that same connection to the world and to the possibility of work. And we also need to consider masks and the way that when we wear them, our face is blocked. So considering what a face shield might do instead, or even finding access to masks that have a clear panel so that people can still see your face and see your mouth while you're speaking. People with disabilities also experience challenges getting to work if they're working outside of the home. The risk of exposure on transit is significant, and there's been a real decrease in frequency of buses and trains because fewer people are going to work, and that means more time spent outside waiting. There's an increased cost of the necessary PPE for themselves as well as for caregivers, right? People with disabilities are responsible for providing PPE to their caregivers, and that is an additional cost that can sometimes be quite significant, especially if it needs to be specialized. And this may not be the case in Vancouver, but I do know that folks out west have had some significant snow this season. But here in Ontario, there are many communities that are having to really advocate for sidewalk shoveling and clearing to happen because it was things that cities were opting out of or that residents weren't doing with the same frequency, making it much more difficult for people with disabilities to get around when they're going outside. Some of the other challenges that people are experiencing are the fact that multiple care providers can in fact increase the risk of COVID-19 exposures because there are people coming in and out of their homes quite frequently, and those care providers aren't always the same person. The loss of support services through work, through school, can have a significant impact on physical and mental health. And assessment centers aren't always the most aware of accessibility and the needs of people living with disabilities. So if someone needs a support person to come with them, that often requires a higher level of negotiation, and you need to talk with the person in charge and you need to go through this and that. It becomes really difficult when what you're looking for is to be able to accompany your friend who has an intellectual disability to try and get them through a vaccine experience. You you probably want to be there, and yet it would involve quite a bit more conversation than you might be comfortable with. So these are some challenges that we don't always think about, but that are coming up for people with disabilities right now. Some positive developments: the COVID-19 Disability Advisory Group has been formed. It is 11 members of the disability community, and they have informed some of the disability-specific strategies and measures that have come and been addressed. They have worked hard to ensure that medical and public health guidelines are disability inclusive. They have tried to broaden a little bit the one-time payment that the government has given to people with disabilities, and really worked hard to ensure that communications from the government are broadly accessible. Working from home has done something very interesting, and I don't know if any of you have experienced it, but I used to work somewhere that it was not okay to work from home. And now I know that that entire organization is working from home. So it's a really interesting thing that's happening, where what we're doing is opening up this adoption of what might be considered disability inclusion practices when we are opening up the possibility of working from home. So it's created this broader conversation at work around what is acceptable and possible that perhaps wasn't even considered as an option before this pandemic experience. So how do we get to accommodation in a COVID-19 context? Well, it's a little bit more challenging because someone isn't standing in front of you, right? You need to kind of figure out what people need. We have to remember that accommodation is a human right. It's fundamental, it's an integral part to equal treatment. This includes dignity, respecting people's dignity. It needs to be individualized. Everyone has a unique need. There's no, this is the accommodation that we provide. People don't need to disclose their condition to you in order to ask for accommodations. So accommodations need to be specific to their conditions and what they're asking. They also need to be inclusive. Removing barriers allows for integration, social inclusion, and full participation in the entirety of work culture, which is something that many of us might be experiencing a loss of, but there are many organizations that are doing really great work around inclusion and creating social environments, even though we're not together right now. People with episodic disabilities require different types of accommodations than people who are living with long-term physical disabilities. So for episodic disabilities, they include time off to attend medical appointments or time to adjust to medication, perhaps a flexible work schedule, or the ability to change shifts or adjust when they're actually at work. Keeping in mind, of course, that quite often accommodations are just flat out refused by organizations. Despite the fact that we know there's a legal obligation, it's still always, we don't have any money for that. Keep in mind that most accommodations cost less than $500, and there are lots of subsidy programs available as well. One example I can think of that for someone with an episodic disability might be useful is a pair of noise canceling headphones, and those are usually around $100. Okay, so that might be something that would really help somebody be more productive and be more present at work, and it's a very inexpensive investment. Something to keep in mind is that symptoms are unpredictable. Stigma definitely affects disclosure. People are concerned that they will be the first person laid off if they disclose the fact that they require an accommodation or have a disability. There's also the ongoing need to disclose. If you think about all of the different things that you go through at work, especially if you work for a larger company or organization, you might need to disclose to HR and then to your manager and then maybe even to a manager above that. And it just goes on and on and on in order to get the accommodation that you need. And that is exhausting work to have to do. It can be very difficult to accommodate folks with episodic disability experiences because of the need to change them, right? The variability in accommodations is a challenge for many employers. Symptoms are often invisible as well, right? And so that kind of plays into the fact that if we don't see it, it's not happening, and that's not the case. So we need to be attentive when people are asking for what they need. Access to medications and treatment is critical, and so for many people with disabilities, maintaining employment is attached to holding on to health benefits as well as a regular income. So during COVID-19, how does everything change? Well, you might be asked to reassign someone based on where their capacity is at right now. One example of this is being asked to continue to work from home, or requesting that even though work is open, my additional vulnerabilities because of an immune system disorder, I'd like to continue working from home, right? Considering those requests very carefully is important at this time. Maybe there's an opportunity to shift someone from full-time to part-time work just while they get some of their health stuff sorted out. Allow them to use lieu time or banked time, or even consider working compressed hours, so 4 days a week for longer rather than 5 days a week. Scheduling breaks during the workday, allowing your staff to block off time and to say, I can't take 5 Zoom meetings a day. I need to do a little bit more focused work, or I need to rest between my Zoom meetings, so back-to-back won't work. Consider overstimulation. This kind of meeting and these kinds of interaction can be exhausting because we're not getting the same kind of shorthand body language clues and other things that we get when we're in person. So it can be very tiring. What can you do? As an employer, first and foremost, demonstrate leadership. Be a leader. Publicly commit to creating these human rights and anti-discrimination policies, and follow through on those plans, right? Be a leader. Review your practices and policies. Consider whether or not they're still relevant. Update them to see what your current work practices are, and make sure that your policies reflect that. Have a look at, there are a bunch of resources online for these kinds of things. Have a look through them. They're really helpful to be able to establish newer, more relevant, and more accessible guidelines for your workplace accommodation policies. Provide accommodation, right? They're necessary, it's legally required, but really flexibility can extend beyond letting people continue to work from home, right? It means acknowledging that there are limitations that workers have and that there are needs, right? Not everybody comes to us with the same skills, which means that they also don't come to us with the same challenges. And require training. Make inclusion, diversity, equity, and accessibility training an expected thing from your leadership, from your management, and from all of your employees, regardless of whether they work with clients or not. And attend those trainings. Be someone who's in the room, who's very connected and aware of the work and how important it is. Ooh. There we go. So some accommodation best practice examples include creating an accommodation plan. I've got a couple of resources at the end of the presentation, and they link you to examples and templates for accommodation plans. Follow the lead of your employer, your employee rather. They often know what's best, so listen. Consider offering flex time, stay open to more frequent breaks, offer adaptive technologies when they're necessary. Consider a peer support program, especially now, if there are coworkers who are missing that kind of personal connection or those drop by the cubicle chit chats. Consider that peer support program and seeing if there's a way to, connect your employees, because they are missing those connections for sure. Consider offering part-time. I see that I've missed a P there. But part-time work with full benefits. This is a rarity, but it's something that people with disabilities often mention when we're talking about accommodation practices, or even part-time work with prorated benefits, prorated to the amount of hours that they're working. It is very rare that part-time employees get any kind of medical benefit or coverage, and so these types of accommodations can be very useful. Be proactive, right? Think about this before you are hiring a person with a disability, before your long-term employee discloses a disability to you. Policies and practices that increase flexibility and accessibility prevent barriers before they occur. They keep your business running smoothly. So do this before an issue comes up, right? Remember that accommodation makes good business sense, right? Yana mentioned that having a diverse group of employees improves your organization, and it can also improve employee productivity to have good accommodations, reduce economic loss due to absences and turnover. Creating an accessible and inclusive workplace culture really helps reduce the need for individual accommodations, because these kind of universally designed accommodations are really useful for everyone. So someone who doesn't have a disability but perhaps is caring for an aging parent may need some of that flex time that you would have only offered employees who asked for an accommodation. But now, if it's part of policy that, yep, flex time is possible, speak to your manager, then that kind of thing is just part of your culture, creating a broader and more inclusive work environment. So lastly, how do we make it work, all right? What is happening right now is that we are seeing an increased demand for regular ongoing work from home. People are interested in staying home, especially some of the time, all right? So see if you can make that work. People also want to be trusted. One of the biggest reasons that employers don't permit working from home is because of trust. They are not certain that the same productivity will happen. They're used to managing by counting butts in seats rather than by results. And perhaps the last year has shown us that this type of work is possible. I am very hopeful that there will be additional flexibility around this for the long term. All right, so how can employers support employees with disabilities? Well, standard policies, right? Create those policies, have a look at them. Was the last time they were updated 1998? Maybe they need to be updated again, right? Updating policy is not everyone's favorite job. There are lots of templates online. There are lots of consulting businesses that do this kind of thing. So really have a look at it, check in about your organizational capacity to do this, and make sure your policies are up to date and reflective of what the world of work, honestly, what the world of work looks like today. Right? Make sure that there are formal HR meetings to establish accommodation plans for individual employees, as well as informal discussions with managers and coworkers about accommodations. There's a fine line here. Employees want to understand why that person gets to take a 2-hour lunch to do yoga, but they don't. Well, you do not disclose to them that they have a disability. You just say that this is what this person needs right now, and when you might need something, come talk to me, okay? Keeping confidentiality at the forefront is incredibly important. Making sure you have a plan for someone coming back to work if they have been experiencing disability symptoms, or they've been on a long-term disability leave or even a short-term disability leave. Some accommodations might be job modifications or flex time. They might need to change their home workspace. And again, they might need to take more frequent breaks. So remember to be flexible, especially in the context of episodic disabilities. The plan might need to be adjusted, right? It might be different this month to what it will be like 3 months from now. And we're all getting used to this new way of working. So staying flexible is really helpful right now. And be sure to communicate, right? Talk to managers and employers to make sure that employees, to make sure that everyone understands what's going on and that this person might be returning at this time, but they're going to have an office rather than a cubicle. There are lots of things that we can do to kind of keep each other safe in this COVID context at work, but we need to be communicative about it, okay? Checking in with that employee if they come back to work after a leave is really important. Having that little bit of structure and that maintenance of a connection with management, with the folks who are in charge is often really useful. We've gone through quite a bit of this, but it's really important here, this kind of bottom bit, to remember that accommodations require long-term perspective. They require flexibility, reassessment, and collaboration. A collaborative approach to workplace accommodation right now is really key. Here are a list of resources that I've come up with. The Canadian Human Rights Commission has a workplace accommodation plan template. ACE is a really great research program, which is accommodating and communicating episodic disabilities. This job demands and accommodation planning tool is a great piece. I was part of the committee that reviewed it, and it should be coming out really, really soon. Arthritis Canada has lots of resources. The MS Society has an incredible employer's guide, and the organization that I work for, Realize, produced a document called a win-win proposition, which is a business case for actively recruiting and retaining people with episodic disabilities. And that's it. Thank you so much. It was an absolute pleasure to be here, and I'm really glad to have had the opportunity to share my experience with you. Thanks.
Thank you very much, Yana and Melissa, for this timely presentation and the amazing information on the impact of COVID-19 on inequalities and work, as well as tools and tips for accommodating employees and making the return to work. Let's jump onto the Q&A segment of this webinar. So the question is addressed to you, Yana, but please, Melissa, feel free to jump in if you'd like to add anything to it. After seeing the recommendations for employers, is there any that you have found more effective than others in implementing in a workplace to see real change? Alternatively, what do you see as a strategy that could be a quick win to build momentum in this area?
Let's see, that's a great question. I think my answer will be first US specific. What we're seeing as one of the most effective policies for employers is to give paid leave, both paid family leave as well as paid sick leave or some sort of earned sick leave policy, because we don't have that at the national level still in the US. And I think going globally, for whatever shortcomings national policies have where employers can come in and give additional leave, there's so much scholarly evidence showing the beneficial effects of generous paid leave policies on working families. They help with women's labor force attachment, even with child health and overall well-being. And in terms of fairly quick and easy, I think policies would be a quick win. I think this participant put it right now, a quick win would be to institutionalize some sort of telework policy to go beyond the pandemic, and not just have that be an emergency response, but to have that be a permanent option for workers, for occupations that where it is feasible to work from home. Let's not have this be temporary, but to institutionalize that as an option.
Thank you so much. Melissa, would you like to add anything to that?
I agree absolutely with Yana. Absolutely. I think that creating a policy around work from home is really important. We need to begin to formalize some of the inclusion practices that have come about from this particular global experience. This has been a benefit to quite a number of people. And if we ever do get back to a place where kids are going to school really regularly and every day of every week, having a work from home policy would be incredibly useful to many, many families as well.
Absolutely. Thank you so much. And Melissa, the next question is for you. What can employers and leaders do to show employees and potential employees that they're willing to be flexible so they can accommodate people with episodic disabilities?
Be really upfront about it, right? Have a lot of job postings have a little statement at the bottom that says, like, contact us if you need any accommodations. Give an example of what that is. If you'd like the questions in advance, send us send us an email, right? Be explicit about what you're willing to offer as an accommodation. So much of the burden for asking for accommodation and figuring out what that accommodation could be falls on the people with disabilities. And that is an exhausting thing to do. And sometimes they can't even think of it, right? I mentioned noise canceling headphones because that's an accommodation that's incredibly simple and really can have a huge impact on somebody's work life, especially if they have to work in a cube farm, as somebody once called it, just like a whole huge series of cubicles. That can be really, really useful for, blocking out distraction and trying to focus. And people don't think about that, like that just, never even thought of it. But that kind of thing, really minor, super effective. So be public, be open, include accommodation statements. Make sure that when you're talking about equity and diversity and inclusion, you include accommodation. It's a really easy acronym, IDEA, right? IDEA. We can do this, but we need to be talking about it, right? We've done some work, we just need to keep going. We need to do the little bit of extra work too.
Thank you so much, Melissa. And building off of that, how can we handle other employees who think that accommodations aren't fair to others who don't need accommodations?
Well, I'll start. I think that this really falls into that definition of kind of equality versus equity, and we need to be really aware of what that is. Equality, everybody getting exactly the same thing, so it's all fair. Equity, acknowledging the fact that not everybody comes with the same levels of things, accessibilities, all of that, and making sure that the folks who are here get brought up to the same level as everyone else, right? There's a wonderful image online. I'm sure you can find it. Just Google equity versus equality, and you will get a whole bunch of images and explanations of that. But that's where it's rooted, right? People are considered like really worried about fairness, right? And fairness is a real challenge when we're talking about where you're at, what skills you have, what privileges you have, all kinds of things. So when we approach things from an equity-based lens, we get people on the same playing field, but that doesn't mean that everybody gets the same accommodation to get there.
Yeah. And I think to follow up on that, sometimes even language can help. So an employer, instead of calling policies family-friendly policies, can call them, work-life policies or work-life balance for those single people who are worried about issues around fairness and equity and thinking, I don't have a family, I'm not going to benefit from family leave. If they're labeled as promoting work-life balance, I think even that kind of wording can help the packaging of these kind of policies and accommodations, especially those that are geared towards families, but people who don't have families, say who are single and don't have children, can still take advantage of some of these.
That's an excellent point, Yana. Thank you so much. And talking about equity, it looks like as though there has been positive movement in equity amongst men and women in unpaid work. What factors have led to this, and how can we support this momentum as employers and as people?
Yeah. Probably the biggest factor is lockdowns that have affected both men and women. So to the extent that occupations can be done from home, it's not just more women working from home during the pandemic. Men are working from home too, and they are, being forced to, if they did not before, engage in more unpaid caring work as well as domestic work. So it's right there. They, by maybe no choosing of their own, they're now put in these positions where they're engaging in the work that before they did not. So it's a simple function, I think, of the lockdowns and business closures.
Thank you so much, Yana. And Melissa, you mentioned that attending training about inclusion, diversity, equity, and accessibility, so IDEA, could be helpful. Are there any particular training resources that you would recommend in relation to these areas?
Oh, honestly not off the top of my head. However, there are so many of these kinds of things that exist attached to our city governments as well as to our provincial governments. So have a look there and see if there's something that's provided. Many universities also offer these, so if they do trainings outside of their university contexts, those are great. And then have a look at the grassroots community offerings out there, right? Like that's where I work, right? And so we do lots of those kinds of trainings. Ours are always specifically related to disability and work, but there are tons of organizations that are doing this idea work right now, and really trying hard to deliver workshops to interested places. Reach out, all right? I would love it if someone emailed me and said, hey, I need a workshop on episodic disability and work. It's great, but I'm always having to do the asking. So if you've got the motivation there, reach out to some of these places. I'm sure they'd be happy to get on the Zoom with you and have these conversations.
Thank you so much. And then to you, Yana, the increase in domestic violence statistic was worrying to learn. So how, as employers, can we support employees in this way, and particularly knowing that this is a sensitive topic and that employees may not come forward with? Are there any signs we can look out for? How can we support those employees, and are there any resources we can provide to them?
Oh, what a good question. I'm not sure of any specific suggestions. I know what not to do, and what not to do is, to ask employees to take a survey, with big questions where potentially if they're living with an abuser and the abuser can see or monitor their online activity, doing something like taking a survey could potentially be a trigger for more violence. So whatever employer practices are taken, I think a key word is discretion, and some resources that can be accessed with a lot of discretion and that won't trigger more violence. But as when it comes to specific kinds of suggestions, I'm not really sure, but they need to be safe. If an employee is going to turn to that resource, he or she needs to be safe in doing so.
Thank you so much, Yana. And our next question is for Melissa. During your presentation, you noted that everyone has unique needs. So what are some things employers can do to ensure they're capturing the information they need in order to understand and address these different needs efficiently?
Accommodation plans are good for that. And when the ACE project releases the JDAP tool, that's also a very comprehensive set of questions that employers and employees can go through together. So keep your eye open for that one. But those accommodation plans will give you a template where you can ask those specific questions about, when you're feeling like this, what might be the best thing? Here are some things that we've done in the past, or some things that I heard in a workshop that might be useful. Are these things that you might find useful? But constructing those plans is important because then you have an agreement and that employee has a commitment. So you've both acknowledged that this is a need, and you've both acknowledged that this is what you're going to do going forward. Staying flexible around those things can be challenging. We're all very busy, but revisiting them every 3 months, every 6 months, or as needed, just to check in about whether or not those accommodations still stand. So find a template, and really, if you'd like to talk more about this, please reach out to me. My email is widely available, so you can find it from pretty much anywhere. But yeah, we can have a talk further about this, but accommodation is so personal that it's about creating an environment of listening, right? To be able to give someone space, to trust them that they're telling you the truth and that they're asking for what they need, while you are able to stay open. And you might not be able to provide everything, but you will work hard to provide what you can.
Perfect. Thank you so much, Melissa. And then if you are seeing inequities within or inequalities within your own workplace, do you have any advice on how to approach the subject and the best first step to take as an employee, maybe, but also as an employer?
Let me approach that question from the standpoint of gender gaps. And in being an employee, I think that a first step would be to see within the institution where one is working if there is an office or an ombudsperson, or a system for reporting these inequities and having them be created. Like at my own university, we recently established a task force and a group where people could report pay inequities and provide evidence that they were being paid less than somebody else in a comparable position with comparable credentials. And if that doesn't work, then a longer run step may be to ultimately seek help from, if one is unionized, from the union, or to go to something like a government body. In the US, it would be the Equal Employment Opportunity Commission, the EEOC, and file an actual claim. And at Rutgers, our union did file a claim against the university for gender pay gaps. So we ended up needing to go outside of the university. But yes, actions do need to be taken. I think staying silent will result in nothing. So a first step would be looking at resources and institutions and procedures within the institution, and then potentially going beyond and possibly even a legal suit in order to correct the gaps.
Thank you so much, Yana. And then Melissa, would you like to add anything?
Just a little bit. Understand that there is a requirement for compliance, especially in the context of disability accommodation, and so check in with the Ontario government, because that's where that kind of legislation lies. And there's a lot of information there. There are also grassroots groups that have done a lot of great work around advocating for accessibility. Have a look for those as well, because they can assist in this department. It's very, very challenging to witness inequality and that kind of discrimination. And if you work in a smaller environment like me, there's no union. We're a staff of 6, so we're a small place. And if that was the kind of thing I witnessed, I would be really challenged to take. Where would I take it? And it would probably have to be the board of directors, right? And so thinking about what that means for me as an employee. Does that put me at risk? How does that kind of unfold within the context of your work? So keep in mind some of the other pieces, and if you can get an outside person or agency involved in some of that advocacy, it may very well be helpful as a bit of a buffer between you and any risk that might come.
Thank you so much, both of you. So would you say that there would be some added value for an employer, for example, to initiate that conversation before such an incident would happen? And how would you advise them to approach that conversation with their employees?
I think that would definitely be valuable. It often doesn't help, and it often does not occur in that direction. But if an employer were to spot these kind of inequities, absolutely. And I think going back to something both Melissa and I talked about is increasing diversity and inclusion in the workplace. Now, many organizations have diversity and inclusion officers and offices that are looking within their organizations and looking for these kind of inequities. So hopefully that's a huge step towards employers being more proactive in addressing discrimination, whether it be in hiring or promotion or in pay, and doing something about it before it's employees who are bringing the complaints forward.
I agree, absolutely. There have been legislation changes when it comes to workplace policies around things like sexual harassment. And when those policies are implemented, quite often it's done, like, oh, here's another page to add to your binder, or the PDF for your policy has been updated, that kind of thing. Do a training, right? Give your employees an opportunity to really understand what the policy that they agree to every day, what's in it, what does it mean, right? Everybody read it when they first started, but as these things get updated, it can be really good to do a quick session. Hey, this is what's in your employee manual, do you know? And give folks that opportunity to think about whether or not they've seen things, or that things are happening that you may not know about. But that puts you in a position of being a trusted, reliable source of information and a place to go to should they need an accommodation. I always try and remind people that if you are able-bodied, that is a temporary state of being, okay? We are all just, a year away, 6 years away from some kind of disability. And so we need to remember that a lot of the work that we do now is stuff that we will eventually benefit from. Right? And thinking about it in that way can sometimes be the key to unlocking this work for folks. Lots of people are really happy doing work for others. Some people need to connect it to themselves sometimes, and that is a good way in.
Great input, Yana and Melissa. Thank you so much. And moving on to our next question, what is the best way to make a request to your employer who has not offered family-friendly policies, or, as you suggested, Yana, work-life balance policies?
Yeah. I think probably the best thing to start with would be just to do a little research. Melissa had mentioned compliance. First, find out if one's employer is in compliance with a national or state law or local law when it comes to policies that they're supposed to be offering and are not. And if they are in compliance with offering at least the legally mandated minimum, then see if you can find out what other employers in the same sector or industry are offering as a benchmark, especially other employers of the same size. So then one could approach their employer with information on competitors and what they're offering as a way to kind of increase the bargaining power. And it does sound like, there would be some bargaining involved, and coming equipped with information about comparable employers, I think would be one of the best strategies in requesting similar policies at this particular institution.
Thank you so much, Yana. So we have time for 2 more questions. I'll go ahead and fire our 2 last questions. So Melissa, you talked about how sometimes managers don't trust their employees to work from home unsupervised. Can you share any tips on what can be done to help build trust?
Well, it kind of depends on which side you're asking for. So I'm going to assume you're an employer because that's sort of the audience here. Consider creating kind of additional benchmarks, right? I have not checked in with my ED for a long time. She is my supervisor, but since I've been working from home once a week, I need to talk to her because it helps me. But that kind of thing can create structure, right? Other folks that I know have quick, like 10-minute team debriefs or team huddles every morning or every afternoon, right? As the day opens or as the day closes, just to give folks a sense of a little bit of social interaction, but also that, like, we're still at work, right? You may be wearing your pajamas or the same leggings that you had on yesterday, but we're still at work. So, there's no requirement for dressing up for these kinds of things, but it does create that connection. Trust is largely about connection. And when we really connect with our employees, that trust can be built. And when we are honest about what our expectations are, how quickly do you want this done? And always remember, one thing that I've been speaking with my colleagues about in the last couple of days has been how we're all experiencing a huge uptick in the amount of work that we're doing. And we've decided that it's because it's really easy to send something over email. oh, here, get this done. Oh, here, do this. Oh, here, do this. But you don't need to look at my face when you hand me that, right? To see me go red or to see my whole body tense, right? We're missing some of those physical clues that were, oh, that's a bit too much. And having to write an email that says, this is too much for me can be really tough. So remembering some of those pieces when we're trying to build trust, stay aware of workload, inquire about workload, and try not to make it too burdensome on your employees to constantly have to, provide me with an hourly breakdown of what you've done, make sure that all of these things are complete, send me an email if you're having a problem. Take on some of that work as well, right? Be a resource.
Great, Melissa, thank you so much. And our last question is to Yana. So is there any data or interpretation of data to determine why the population of workers in the frontline industries highlighted is higher for women, particularly women of a minority race, as opposed to men?
Yes, and the data is really by country. Well, there's data to support it and data I think the question's asking a couple of parts, but in general, more women are working in frontline industries because frontline industries tend to be caring sectors like health services, social services, and also low-wage work like the cashiers, and logistics, and relatively more women and relatively more minorities work in these lower wage jobs and or caring jobs. And the way to support that is usually with national labor force statistics. And each country collects these. US collects this data, Canada collects this data, and then it's just a matter of going to, they're usually already published, by month, the proportion of workers in each sector, industry, or occupation that's male and female. And this data is usually reported fairly quickly after it's been collected. So the information is quite accessible, and you don't need to be, a top-level economist to be able to get the statistics. It's pretty accessible from the national labor websites.
Thank you so much, Yana and Melissa, for this important information on the barriers to work and how can employers address them, as well as how organizational policies can be developed to support employees during COVID-19, and also how to accommodate employees who need it. A few reminders: the presentation is recorded and will be posted for free on our website along with the slides. If you're a WWI, VRA Canada, or CPHR Alberta member, you receive free certificates of attendance. Immediately following the webinar, you will be directed to the evaluation survey. We greatly appreciate your input on our webinars as well as suggestions for future topic areas. Thank you so much, Melissa and Yana, for this amazing webinar. And our next webinar is a panel webinar on employee legal rights during COVID-19. It will be held on Wednesday, March 17, and open for registration on Friday, February 26th. All of our webinars are created for public access and supported by voluntary donations and memberships. Thank you again for your participation and have a wonderful day, everyone.
Thanks, everyone.